this video, I wanted to just quickly talk about serotonin, but I want to note that when we're talking about mood stabilization, there are a lot of neurotransmitters playing a role here. So it's not only serotonin that I'm about to talk to, but it's also, dopamine, adrenaline, noradrenaline, glutamate, there's GABA, there's a lot of other neurotransmitters that are involved in stabilizing our mood. But we do know that serotonin plays a huge role in things like depression. And a lot of that comes from seeing the use of medications like SSRIs, which actually help to keep more serotonin in the neuronal synapse. We can see this working for a lot of people with depression, helping them to feel a lot better. And we can see then if we were able to increase the levels of these neurotransmitters and they help with mood, then we know that they must play a role in mood stabilization. But what I want to talk about with serotonin here is the capacity for serotonin to actually go down two different pathways. Or in other words, its precursor, which is tryptophan, an amino acid, the ability of that amino acid when we bring it into our body to be converted either into serotonin or into another pathway, which is called the kynurenine pathway, which can lead to the production of something called quinolinic acid, which is involved in neuroinflammation. So let's just stop for a moment and go through what actually happens. So we bring in tryptophan, which is an amino acid. Now, tryptophan can actually be produced in our body, and a lot of people will talk about tryptophan as being a non-essential amino acid, and it is. But what I also want to point out here is that its precursor, which is the amino acid phenylalanine, we use that to make tryptophan if we're going to make it in our body endogenously, and we rely on our diet for phenylalanine. That one we do need to get from our diet. So let's say we bring in phenylalanine from our diet, or we make tryptophan from phenylalanine in our body. We can then convert that tryptophan into serotonin, which, as we just talked about, helps to stabilize our mood. And serotonin actually plays a bigger role, in fact, in the afternoon and latter part of the day to help us to feel relaxed and sort of chilled out, and also just, happy with the environment around us. We're not seeking things out. We're not looking for more stimulation. We're just chill. So in this way, serotonin obviously plays a big role in stress and anxiety reduction. But as I said, there is another pathway that actually we can use that tryptophan to funnel down. And the reason we'd go down this other pathway is when there is inflammation, so neural inflammation, inflammation in the brain. Why would that happen? Well, there could be a number of different things. Interestingly enough, a lot of inflammation in the brain can actually come from the gut. It's not always from the gut, but it can come from the gut. And the reason for that is that we have this brilliant thing called the blood-brain barrier, and that actually prevents a lot of things from our regular bloodstream getting into our brain. But what can actually happen is when we have leaky gut, this can also make our blood-brain barrier leaky as well. So things that are in the bloodstream that are stimulating the immune system and immunomodulators like cytokines can easily pass from the regular bloodstream into the brain. And this can actually stimulate, neural inflammation. So let's say that there are some cytokines floating around. There is some neuroinflammation. What can happen then is it will activate a different pathway. As I said, we've got that tryptophan, and it can either go into making serotonin, making us feel good, relaxed at the end of the day, but we can also activate this other pathway, which converts that tryptophan instead down through to the kynurenine pathway, and we end up forming this thing called quinolinic acid, which is essentially a metabolite, and it is quite neurotoxic. So if there's, neurotoxicity in the brain, there is inflammation, there's cytokines floating around in the brain. Not only is that actually stopping us from producing as much serotonin as we really want to make, but it can also therefore impact other neurons as well. As we know, our brain is filled with lots of neurons, and they're all firing out different neurotransmitters. And as I said, all these neurotransmitters are pumping out different things. Glutamate, it might be GABA, helping us to feel calm. It might be adrenaline, noradrenaline, helping us to get up and go. It might be dopamine, giving us drive and focus. So, all of these neurons can be impacted by cytokines and neuroinflammation. So while I'm not your psychologist and I'm not your doctor, and so I wouldn't try to take the place of telling you what to do about medications and supplements necessarily, What I will say that I think we can all utilize is understanding this pathway and understanding, well, certainly if there is inflammation and this is affecting mood, we need to figure out where that inflammation is coming from. And, natural health practitioners can better help you to get to that point. Other things that we need to consider here is that this pathway is producing a lot of something called NAD, which our body naturally likes to produce in order to help with inflammation. It's essentially a product that we use to reduce that inflammation in our body. And so perhaps supplements like NAC, NAD, glutathione could be useful if there are mood-related disorders as a pairing perhaps to medications that people are taking, or even if you have a mild case of just mood disorders, you could use your diet and you could use supplements like that to help to support this whole process. Another diet-related or supplement consideration is EPA. Now, I'm not talking about EPA and DHA, I'm talking about EPA specifically, and there have been a lot of good studies showing the efficacy of EPA at around 1,000 milligrams per day and its use in depression. So while again, I wouldn't say to somebody to replace your drugs with EPA, I do think that if you're somebody who's thinking about your mental health and you're struggling with mood, I would certainly think about utilizing EPA at around 1,000 milligrams per day. Now you can get that from fatty fish, so that's something to keep in mind as well. Sockeye salmon, even farm salmon has a lot of EPA in it. I think it's something like 500 milligrams, so that's something to consider. Also, fatty fish roe as well, so their eggs are also a really good source. So why would omega-3s be useful in something like depression? Well, as I said, with this pathway, if we are actually converting more of our tryptophan that could have gone to serotonin production into this kynurenine and quinolinic acid pathway, then we need to think about, well, what's causing that inflammation, and is there anything that we can reduce that inflammation with? Now, as I said, if we use things like omega-3s, we know that they are anti-inflammatory as opposed to other essential fatty acids that tend to be able to be utilized to make more pro-inflammatory things. And while we need a balance of both, certainly having a higher level of omega-3s and like EPAs can be useful to reduce body inflammation. There is also some research that I think we need to do more into, showing that perhaps we can actually sequester some of that kynurenine into our working muscle. What does that mean? Well, when we're doing rhythmic movements like cardiovascular training or resistance training, we can possibly sequester some of that kynurenine into the muscle so that it cannot be converted to the quinolinic acid. And I think this is really cool because it could be showing some of the mechanistic pathways as to why exercise can be useful in things like depression. Oh,